Are you approaching 65 and still happily working, but now facing the big question of Medicare enrollment alongside your existing employer health insurance? You are not alone, and it is a common crossroad many people encounter. Yes, you can absolutely have both employer insurance and Medicare at the same time, and how they work together largely depends on the size of your employer and the type of coverage you have. This flexibility allows you to make choices that best fit your healthcare and financial needs. The core reason behind this flexibility lies in what is known as the primary and secondary payer rules, which dictate which insurance pays first for your medical bills. If your employer has 20 or more employees, your employer health plan typically pays first, acting as the primary payer, and Medicare then pays second for any remaining covered costs. This scenario allows you to keep your robust employer coverage while potentially using Medicare to fill in gaps. However, if your employer has fewer than 20 employees, Medicare usually becomes the primary payer, meaning it pays first, and your employer plan pays second. Understanding these rules is key to coordinating your benefits effectively. First, carefully review your employer-sponsored health plan to see what it covers and what its deductibles and out-of-pocket maximums are. Then, consider enrolling in Medicare Part A, which covers hospital insurance, even if you keep your employer plan, as it is often premium-free for most people. You might choose to delay Medicare Part B, which covers medical insurance, without penalty if your employer plan is considered creditable coverage. A significant benefit of having both is that Medicare can act as a valuable backup, covering services or costs that your employer plan might not. This coordinated coverage can lead to lower overall, out-of-pocket expenses for your health care. For instance, Medicare might pick up the tab for certain services after your employer plan pays its share, potentially saving you a substantial amount, especially with major medical events. Ultimately, balancing employer-sponsored health insurance with Medicare requires a thoughtful look at your current health needs, your financial situation, and the specifics of your employer plan. By understanding the primary and secondary payer rules and carefully timing your Medicare enrollment decisions, especially for Medicare Part B, you can secure comprehensive and cost-effective healthcare coverage that supports your well-being during your working years and beyond.